afternoon, everyone, and welcome to another session of the HSRC Connect. Now, today, we are going to be talking about something very sensitive and potentially uncomfortable for some of us, and that is the topic of filicide. Now, for many of us who don't know what this refers to, filicide is when a parent takes the life of their own child. And so I'm just warning our viewers today that it is going to be a sensitive conversation. And so that we are all just prepared for that. So let's get into the conversation today. I have two panelists, not a big discussion group today, but I think that the conversation will still be impactful. I'm going to ask our panelists to introduce themselves, and then we will get into our discussion. So you are both welcome.
Thank you. Thank you. Hi, I'm Khadija Khan. I'm a senior research specialist at the Human Sciences Research Council. My background is psychology and research methodology with a focus on children and adolescents. And this is how the work ties in with my research interests.
Thank you. Welcome.
Thank you.
I'm Christina Namdu, the Western Cape Commissioner for Children. And so our office is an institution as an oversight mechanism over the social sector of government, health, education, social development, cultural affairs and sport.
Yeah.
And we've been going since the 1st of June 2020. So we've just published our third annual report, and we're very proud of that. And there are some details in there that's also applicable to the topic.
Oh, welcome. Welcome, welcome, welcome. And I think this is going to be a good conversation given the two kind of perspectives that you will bring in the work that you do. I now cannot remember if I introduced myself, so I'm Candice. I'm a Chief Research Specialist here at the HSRC, and yeah, very interested in research around family well-being, and so this is something that's quite interesting to me. So let's talk about filicide. What is it? What do we need to know about it?
Okay. Yeah.
Go ahead.
So filicide is, as you mentioned, it is the deliberate killing of a child by the parent or guardian. In South Africa, it's particularly guardian also. And so we recognize, and based on the literature globally and within South Africa, we do see that it is across various cultures, geographic locations, and socioeconomic conditions that filicide does happen. So filicide is, I would regard it as an umbrella term for different types of child murders that are committed by the parents. And so you'll see within literature and across the work that is being done, neonaticide is the killing of a newborn baby. And so there's the definition of that being, it can be the first 24 hours up to 1 year.
Okay.
And then also infanticide is another form of filicide where the child is under the age of 5 years old. And then also there's other types of filicide that is linked more to the motives, such as suicide filicide and revenge filicide, which I'll speak to when I speak around some of the contributory factors. But I think one thing to mention around the definitions of filicide is that these definitions somehow make it difficult to get a true understanding of the magnitude of the problem.
Right. Because, like you said, there's particular aspects of filicide and so forth. And just to confirm again, it is the minors that we're talking about.
Yes. So child in this case is really anything under 18.
Anything under 18.
Yes.
Okay.
That's how we play.
All right. And so let's talk about what you just explained now around what does this look like in our country?
Yeah.
So what do we know about filicide in our country? And you mentioned something very interesting now, which I think is often the case with different statistics that we need to gather. It's difficult to get this information.
It is difficult. And so I can refer you to other studies that has been done. Particularly around more broadly child homicide. That was by our colleagues at the Medical Research Council, Prof. Naima Abrams and Prof. Shanaz Matthews. They've done national studies looking, and I think theirs was more assessing the babies or the children from a mortuary, and so their source of data was mortuary cases. And so the data there shows there's different categories of data that can be highlighted, and there was some work around neonaticide and infanticide from the colleagues at MRC. From our perspective, we've tried to look at the why of what's going on, because sometimes it's very difficult to unpack if we don't know the magnitude, and so we want to understand one death is too many already, and so our understanding is really around why is this happening. And so it's really, I'm going to speak to, we've done a media analysis between 2003 and 2003 and 2023. And so we've actually seen that the media coverage of filicide spiked after COVID. And so in 2022, we've seen majority of our cases being reported. And we do see mother perpetrators and father perpetrators, and mother having a variation of, it can be the biological mother or foster mother, a grandmother as well. And we also saw variations of father being the biological father or stepfather or mother's partner. So those are just some things in terms of perpetrators and the victims. I think something that also is quite important for us is filicide occurs where multiple children are killed in one incident.
So is that something? Is that something that you've picked up now, that it's occurring with multiple kids being the victims?
And so it's also because families, there's not only one child, so there's very few that it's only one child that is the target of the filicide. And so this speaks to some of the why, that it's not necessarily a result of child abuse where the child is fatally injured because of child abuse. And so this is really more than the abuse or aggression from the parent on one child, where it becomes, okay, the child is now, you know, has succumbed to the injuries. And I think this speaks to there being other underlying factors for the parents' perpetration of filicide.
And so, I mean, we also want to be clear that it's the abuse in itself is also still a problem. And I'm just wondering about some of those reasons. So there's two things that you said now. You spoke about COVID. You mentioned COVID, and then you spoke about multiple kids. So I think the one thing that stands out for me is the COVID element of it. What do you think, or how do you think COVID contributed to that? And I know you see the media analysis, so it is about how it was reported and how often it was reported in the media, right? So that's one piece. But I'm wondering just about, is it also the isolation and the fact that we were, you know, in that space of COVID? Do you think that had a role to play in the perpetration of filicide or not?
I think so, and just broadly thinking about the overwhelming stresses that parents may face, given South Africa's economic climate. It's really, we do see parents battling to actually provide the basic needs for the children. And so parents then end up feeling hopeless about their children's future. And filicide is this distorted idea that I am saving my child from that suffering later on. So it's a merciful act for them to then kill their children to stop them from, you know, having a trajectory which isn't something that the parents would want for them. So I think economic conditions really do speak to that. It's also the mental well-being of the parents itself and psychological problems. So what we see in the literature is that mental health problems such as depression, psychosis, and personality disorder are conditions that are implicated in filicide when perpetrators are trialed. But also what we saw in our media analysis was that mother perpetrators were previously diagnosed with depression. And with fathers, it was only identified or diagnosed during the trial and investigation that they found this person had depressive or had depression. And so we can see that untreated mental illnesses is something that we need to actually bring to the fore, and
Right.
particularly targeting men around maybe some, and I know we're moving now to prevention also, but I
Yeah.
think that is just something to look at in terms of men and mental health, targeting certain interventions for screening.
Right, right,
Yeah.
right. And I think we'll pick up on that a little bit
Yeah.
just now. I wonder, Christina, if you could maybe talk about the impact of filicide. Now, filicide occurs in a family, right? It's not just, it's not outside of family. It's in the family, it's in the community. It's got a whole lot of people that are affected by this. I wonder if you could speak a bit about that, just on your experience and the work that you've been doing.
Yeah, I think our work really goes to collecting primary data directly from children.
Wow.
So it's very important for us to listen to the voices of children and their lived realities within their homes especially. And what children tell us is across the Western Cape, and we've been to many districts across the Western Cape, and this has been a prevailing theme, that their homes are one of the most dangerous places that they must survive.
Wow.
So that goes to, family dynamics that really put children's life at risk, and to the extent that they may eventually be killed by their parents, as this Filicide study shows. We're very interested in this type of deeper disaggregation of child homicide, because for us then shows around which risk factors we need to place more emphasis on when we do our prevention work. So, for example, you've mentioned mental health and mental well-being within a family. I can remember that as being one of the first issues that came to my desk from children.
Wow.
Mental health. And I think that during the COVID times, we all became sort of comfortable with talking about mental health.
That's true.
So there was a kind of destigmatization a little bit about mental health, just about being well. Maybe not to the extent of understanding mental illness.
Right.
And accepting mental illness and understanding what support systems need to be in place for mental illness. So I definitely can see that this work that Dr. Khan has done can shed some light into the disaggregation of data, can shed some light on the prevention strategies that need to be developed, and how households need to be supported. I mean, we work from a rights perspective, right?
Okay.
And we understand that all rights are interdependent.
Yes.
So if you don't have socioeconomic rights, your freedoms and liberties, civil and political rights, is going to be compromised, because you're not in a place, you living from a survivalist psychology rather than living on a thriving self-actualization psychology. You know, I'm just throwing in words here from my own undergrad degrees.
Yes.
But I'm not by any means an expert in psychology. And so I would love to hear from those experts, about the profile of the family, the profile of the parent, in order for parenting support programs, which are pioneered by our departments, which we oversee, like social development and health. How do we customize those programs to our reality here in the Western Cape?
Yeah. And I wonder, I mean, I think I hear you about your undergrad and all of that, but I think you are a professional in working with this work. And I wonder if you could share or just think a little bit about the work that you've done with children and the information that you've received from them through their own voices. I always think, it's so powerful. But when children speak, we must listen. And I wonder about what you think you've learned about that profile. Because there must be something, I mean, you learn about the profile, so telling you. And I wonder, is this, what are maybe the top 3 or top 5 things that you've learned about that profile that you think are important for researchers to also take forward in the work that you do?
Yeah, so, we work with children in different ways. One way would be our community child rights workshops, where we go in communities and we ask children about their worries and their dreams. This is a very powerful session for us, and their worries are anonymous. So they can be honest about them, but they are encouraged to take my WhatsApp number, and if they have a personal worry, they can address it to me, and I can arrange a referral network for them. Referrals are on call for us. But, as you can imagine, children unpack for us the concerns they have about their family, especially about poverty within the household. So for me, this is a big factor, right? How children experience poverty in households, and you know, in their dreams, we've made this analysis. In their dreams, they all want to become doctors, lawyers, and accountants.
Right.
The reason being, they want to save their families.
They want to help you.
Wow.
They want to save the economic part of the family. They want to invest in their communities. We always think of children as selfish and self-centered and
Yes.
self-serving, but they really aren't.
Yeah.
They really are deeply social beings. They're concerned about the well-being of their own household, of their community. So when they feel they have a little bit of means, they want to plow it there, in their family, in their community, to increase the well-being.
Yeah.
When we work with children more intensively, like our child human rights defenders, I call them child government monitors.
Okay.
So these children can nominate themselves in those community workshops.
Oh, wow, so these are with children. These are children
I
themselves.
only work with children directly. That's my
That is
primary audience.
Wow.
So
amazing.
they would nominate themselves, or community members would nominate them, or the children in the workshop would nominate them. Or they will meet me on Facebook, or they'll meet me on Insta, or they'll meet me on TikTok, and they'll say, I've heard about you. You do interesting stuff. Can I become involved? I always say the opening gambit for any child to talk with the commissioner is to take my WhatsApp number and say, hi, Tina. That's your application process. Hi, Tina. And so we discuss with you, what are your concerns? And through working with children, I think, and I work with children like that intensively from about 12 years old. So from that very important nexus, at 12 years old, you acquire many autonomy rights in your life, right? And you become like there's a different phase of life that's kind of happening for you. So you're able to conceptualize things on a deeper level. And so what we do with children that now come on board as our child government monitors, we help them make policy and law submissions.
Sure.
So children have made submissions of policy, for example, to the Department of Education on protecting queer learners. I'm just mentioning tangible things.
Yeah.
We even asked the Premier, I know, on radio one day about the mental health support systems that we have in place for children, especially at their schools, at the base that we can engage with them most easily. You know, I think the Premier gave a nice answer, but we weren't, of course, satisfied. So we will dig deeper into the infrastructure in all 4 departments that I oversee of mental health services and protocols to support the child and their family. So these activists, these child human rights defenders, they grow with us. And I always say, when you work with children, you can't be extractive.
No.
I only want the research from you. I only want the data from you. I don't care what happens in the rest of your life.
Yeah.
So we hold them, we mentor them. There's a lot of containment. There's a lot of interpersonal engagements with myself and the safeguarding officer that gives us deep insight into their psyche, into what they face, into how they're doing at school, how they're doing in their family. So I think that the kind of information that we're able to get is really rare because, you know, research ethics
No, exactly.
is very concerned about how we work with children, and rightfully so. And we have very strong safeguarding ethics in our office. However, our law mandates and compels us to make children partners in our institution, and that's exactly what we've done. And so they steer us towards those solutions and those issues that are primary for them.
I think what is standing out for me about this conversation and the two of the work that you're doing is the fact that when I initially thought of this, I'm thinking of the perpetrator and how can we stop it and how can we do that, right? And that's important. But I think what I'm hearing from you is the child and the prevention that comes there. And that the reason why we need to work with children in this instance is that we can learn so much about children who are living in adversities, about what could potentially be avenues for prevention and interruption of pathways and that kind of thing. And I think that is powerful, is thinking about the two spaces as complementary. And we need to work with the children, particularly children who are potentially at risk and living in very difficult and vulnerable spaces. And we have to work with the parents who are at risk of perpetration, but also who have perpetrated, and understanding those kind of pathways. And I think that's important. It's important to understand that both is probably going to be a stronger approach than the one.
I think it definitely is. To look at it in that way, if you think of and I think I don't want to shift it to more on the prevention or on the child having some way of having to defend themselves against that narrative. I wouldn't really entertain, but I feel in terms of the prevention work, and I'm just thinking of the types of work in Department of Health where I feel like they are low-hanging fruit in terms of when children go for their checkups. There's certain things that can be done to do somewhat. And I think one of the gaps that we found was that there was, on the cases that we looked at, there were very few cases where there was actually a history of violence at all. So there were not any cases where you can say that the child, there was at least one incidence of violence from the family that could be recorded at DSD. And so we see that gap where the children or the families at risk don't actually reach the level of it being flagged in one of our departments. And so I think that's where the multi-sectoral approach should come in when you think of marrying the parents' risk with the children's risk. So if, for example, parents' mental issues are raised and it's picked up at Department of Health, there should be some flag at DSD saying, well, we should then have more parenting support or support structures, economic support structures, social support structures in place for these families. And I think for me, that is where there's still work to be done around the system, particularly for filicide, where cases where they never actually reach the system that can trigger us to say these are risk factors at DSD.
Right.
So I think that one is something that I still need to wrap my head around. What are some of the prevention mechanisms that we can then put in place for those? And I think I wanted to touch on something else. And this is more to your opening, some of the opening statements you made around the realities of children and the family environment. For us, we found that the relationship status between the parents is so important. And and something that we found was that, well, in South Africa, co-parenting is a huge, happens at large scale compared to married parents or parents living in the same house with their children.
Right.
Both parents living in the same house with their children. And so we've actually seen that this places a lot more pressure on the parent that is caring for the child. But then there's also other issues, unresolved psychological issues that come to play. For example, revenge filicide, which we've seen starts happening where particularly father perpetrators want to punish mothers for their perceived loss of access to their child. Right. So they perceive that once the relationship is over, I won't have the same access to my child. And so it's a way of punishing my child. And so I think thinking about some of those risks where it's not only, and I might be repeating myself by saying this, that we've seen that, and we are of the opinion that it's not only the perspective of the battered child, but it's these relational issues, strained relationships that actually somehow exacerbate filicide and the strain that parents take. So for me, the strain of parents is an important issue that we need to address, whether it be the economic strain, parents not having adaptive coping mechanisms to deal with the relationships that they have either with their parents, with their family members, or even the other parent that they have to deal with. So it's those types of things, and that's just looking at the parent. I think from a child's perspective, this is not even for prevention. This is really once the filicide has happened. I can talk to a case where it was the father spiked the food of 4 of the children.
Okay.
And what happened was 2 of them died almost immediately, and the other 2 were rushed to hospital, but they survived for a period. So imagine that type of trauma that that the child lives with,
Right.
having witnessed some of that, the violence before their siblings are killed. So I think the prevention work there, but then also what do we do after the fact, which I feel like is also something we need to look at.
Yeah, I mean, I think there's a lot that you are saying that I have to just admit is affecting me. It's a heavy conversation that we are having. And I think it's important for us to say that because we must name it for what it is. I appreciated you saying co-parenting.
Yeah.
Because I think we so loosely say broken homes. And I think that terminology is so harsh. And so I appreciate you saying that. And in the same breath, I think we must acknowledge the problem in the fact that we have a term that we can call parents who murder their children. It's a heavy thing for us to have, but we do have that. But I was thinking as you're speaking just about the link between gender-based violence and filicide. If there is a link, do we know about it? Do we need more research on that? Because I'm thinking about what you said earlier, that the one thing is that like you said, there's no mechanism to monitor what's happening in one space and how that filters into the other space. But have you looked at that? Is it something that you might think we need to look at, the link between that? Because I'm thinking even in COVID, there was an increase in GBV.
Yes.
And so I wonder what that had to do with the increase in filicide, at least in the reportings that
I would imagine there is, and that is one of the things that we didn't really hone in on. So we do see, and this is a narrative that is more globally within the literature and even in media representations, where filicide was previously termed the mad mother killing the child type of narrative. And so in South Africa, what we actually are missing is paternal perpetrator profiles.
Okay.
And so we haven't done a lot of that work on paternal perpetrators to be able to say, but I can imagine the violence against women intersects with violence against children. Right? And so I can't really comment on how it contributes more, but those two intersecting already says that there is there's a possibility of that. And so we haven't done much work in terms of quantitatively or even just to identify that or unpack that a little bit. So I think that's a gap that we still need to work on. I don't know if you might have found other...
Yeah, I mean, what we know about families in the Western Cape, for example, is that 50% of children live with both biological parents. So that's higher than the national average.
Yes.
So we need to think about our profile of who lives with the child and the health of that relationship. So it doesn't mean you live with both of the biological parents. They both get on fabulously.
Right.
It might be quite a dysfunctional relationship between biological parents living in the same household. And so one needs to set great store on understanding how we almost restore relationships, whether you are co-parenting, whether you are living in the same house. And then on another level, with teens, I said, it's very important for us to build this kind of skills in teenagers.
Right.
What are positive relationships with your peers? If you get into romantic relationships, what are positive boundaries for those relationships? I recently had a session. We have WhatsApp sessions with our child government monitors. Every Wednesday we have a session from 5 to 7 on WhatsApp, a closed session. and we raise topics of interest to them or to us, or and mostly like sometimes to build skills or knowledge, but sometimes to gather data to, like at the moment we are feeding back our analysis on the budget to
them,
to national government. No, the children are feeding back their analysis to national treasury about what they think about the budget. But a recent session around Valentine's Day, exactly on Valentine's Day, we decided to have a session about interpersonal romantic relationships among teens. And we asked about the acceptability of violence. If they hit you once, is that forgivable?
Right.
If they cheat once, is that forgivable? Those were questions I asked. And the answers are still a bit concerning for me.
Okay.
Because there are patterns of behavior that they've seen modeled in their own parents, where these types of, I think, boundary breaking, elements of toxic relationships gets modeled in the parental relationships that they see, and they think it's acceptable. It's acceptable to be beaten once or twice. It depends on the circumstance, they tell me. And then we try to get them to understand, the elements of toxic relationships, how you need to protect yourself, how there's a lot of self-love, self-acceptance, self-awareness, mental wellness that needs to be in you before you get involved with somebody else. So I think Tara had a Wednesday Words for the Wise, we take Wednesday Words for the Wise, and says, before you must love yourself before you embed yourself in a love relationship.
Oh my!
So that embed a double embed. They didn't understand when I said double entendre. They thought it was an autocorrect word, But I explained. And in actual fact, this saying is much deeper than what it seems on the surface.
Right.
So you can see we get quite profound, voices from Tara's 14.
Wow.
So for her to come to that kind of realization after a session of talking about boundaries and fundamentals of positive relationships, this is really something that we need to also invest in.
Yes.
In addition to, parenting support programs, but it's about like how do we relate to each other?
Yes.
What are positive boundaries? What is elements of toxicity?
Yes.
And that's, I think, where gender-based violence crosses over with violence against children. It's because of those relationships on the same generation, but also in relation to the intergenerational relationships.
Right.
For us, we know child rights is a fearful term, but I say, I don't know why, because all we're asking for is mutual respect in the society. So on a human level, whoever the human is, and whatever age the human is, the person is deserving of respect. And so that's the culture that we try to inculcate in the children as well. That it's not a beating your chest kind of approach, but it's about demonstrating respect and asking for that respect in return. And so these are the kinds of nuances that we deal with in those sessions with the children when we speak to them. We're able to speak really deeply, to their emotional realities as well.
Yeah, and I mean, I wish I could be part of those.
It's closed. I'm sorry.
Come on, I can pass for under 18-year-old.
I think it's closed for our safeguarding reasons. So that we protect them. They know who they're speaking to at all times. They know that everything is confidential. And if we get red flags from things that they say, they know that we will support those issues.
And you're also bringing the point around prevention, right? And I'm wondering if we could speak about that a little bit. So we can talk about prevention. We can talk about intervention too, isn't it? So I wonder if you could speak about that. Just what are some of those, because you're talking about prevention. You spoke about it earlier. So what are some of those prevention kind of mechanisms, strategies, interventions that are available or that should be available? for Filicide?
Yeah, so I think for me, I'll jump onto the relational aspect. And so quite interesting what Christina was speaking about from our media analysis. We actually found that most of the parents were married, and last week I presented in an in-house gathering, and someone asked the question about what have we looked at the quality of the parents' relationship. So I want to touch on that again. And so when I look at prevention, I do definitely think it's those long-term, not starting when the person is at risk, let's say a few weeks in, or whatever, time is elusive here, but I mean it's those long-term, starting from when we are still grooming people about whether it be the norms around a relationship, even gendered norms, thinking around those, protection of, and I think for me, there's things particularly around the narrative that women need to be superwoman, right? And so there's stigma around seeking help when you're not coping. And I think just an example from last week's conversation was around, you know, sometimes there's a little bit more support for a first-time mother than there would be for a mother who may have 2 or 3 children. Right. And someone was saying in the group that we had, this person felt comfortable to share with a friend that this is my 3rd child, but I just had a meltdown, you know, and it was just too much for me. And so I think prevention at the level of reducing some of the stigma around not being okay, which is the mental health component, but also enabling supportive environments, or creating supportive environments where I think in some traditions and cultures, there's children are regarded somewhat in a high, they are considered quite highly. And so there's this level of protecting your child, but at any cost, right? And so that feeds into the narrative of, if a mother can't cope with it, then she's not the best mother. And I think that is where we also need to tap into the traditional components of what motherhood looks like. And I think that motherhood or parenting looks like. And that is things that I think would be a starting point, is to have those, changing those narratives around not being okay, doing the best that you can, but also so that what healthy looks like. And I think it's difficult because it's linked to tradition and culture. And so what looks normal, I may not use the word normal, what looks healthy for one family, it might look very different for another family. But I think it's to start having those conversations around it, that it's sometimes okay, and also to challenge when there are narratives around, well, you know, you still need to go and cook, you still need to make sure your children are, all of these types of things. So I think it's reducing the stigma as a big, and it's a long term, it's not going to happen overnight, that I know. It's something that I think would be a starting point. Other types of prevention would really be around more support for parents and the relationship stuff. So if they are, and this ties into something that last year the Constitutional Court found, and this is more with the relationships of the parents, where they found, I get the policy wrong, but it's the Divorce of Certain Matters Act, where only certain families who are married can actually access the office of the family advocate. So this office is really someone that helps with the mediation of the family matters once the relationship dissolves. And so previous it was only for married couples. So parents would go there and say, our marriage is now coming to an end, but we would like to kind of, in terms of custody and in terms of resources, how can we do this? And so they had that type of support. For people who are not married, they do not have that support, and that's where the perceived loss of access comes in, and where the strain comes in, because there's no actual support for the parents to say, well, this is an agreement we came to together, you know, with people mediating the conversation or mediating this. So that actually is something where people then tend to take matters into their own hands, and it feels like they've lost. Or they're trying to make up for, because they've lost in a relationship, but they're also losing their children.
I mean, the word that's coming to mind for me as you're speaking is just complex. Because you're touching on so many different parts of reality and society. You know, we're talking about government, we're talking about services, we're talking about so many different things, policies, rights, all these things that we need to bring to a collective urgency around it. That it has to be one voice that obviously is going to have different tones, perhaps in different spaces, and will speak at different levels. But it is that we need that collectivism around us, a collective urgency around us. And the other thing that I'm thinking of as you're speaking is also the accessibility of mental health services for people. What are your thoughts? I mean, what do we know about what, at least at government level, is available for everyday folks who are not able to pay 1,000 rand because I need some help with whatever it is that I'm going through. I don't have access to mental health support. I don't have the money for it. What is available for our parents who recognize that they are not coping?
So at a primary level, primary healthcare level, I do think what they're trying to do now is, or Department of Health is trying to do, is to have the primary healthcare or the clinic be the one-stop shop for all types of conditions. Right? So the way they framed it now is mental health is a chronic condition, and so I think going to a clinic, and then there's certain referral pathways depending on the screening. I also think that, and I don't work in that space enough to be able to comment too much, but I don't think that communities walk in with the thinking, I'm going there for mental health care. They still see it as physiological. So the clinic is just physiological. And I think the service might be there, and it might be part of the other services that are there, such as the HIV and the other types of chronic conditions, but I think the using it isn't there, or the way it's, so I think there's a disconnect between the service being available and it being used.
Which might also speak to the stigma that you were talking about earlier, right? Around parenting, and if I go for help, it means I don't know what I'm doing.
Exactly.
Right, and so I don't go for
whoever's
help.
working in the clinics are the people that live around me. So it's that, you know, it really just reproduces the whole idea of if I go there, it's not going to be anonymous. And I'm not sure how we work around that. But I think there's that component where people wouldn't want to access services because so-and-so would know why I'm going. That's just a health systems issue that we would have to figure out. But I think that's one of the components. I think mental health is it. I have a background in psychology, and I still ask, because sometimes people would ask me, and I need to ask people, is there other types of services? So I usually refer to DSDs or FAMSA or those people, because I think from a health perspective, I think there is some mandates there, but I'm not sure. I usually refer to social development. I think you might be able to answer a little bit more if there's other psychosocial.
I think I want to talk about this collective urgency and some of the hope that I'm seeing in governments and policy and so forth. So, I mean, the office's vision is to reimagine and remake childhood.
Right.
Because we're not satisfied.
I like that.
With what childhoods look like for us in the Western Cape. I had this chat with the First Children's Commission of India And together there was sort of this coming that, we're not happy with our childhoods. What kind of word can we use to create an aspiration?
Yeah.
So the office definitely has that as a vision statement, and everything we do is geared towards that, and getting the departments who we oversee to sort of see the world from a child-centered perspective.
Yeah.
And I must say that we are seeing positive movements, for example, in the Department of Health and Wellness. There is a violence prevention unit specially funded now. In the last few budgets coming up as they will work very localized in area-based support teams to coordinate service provision, to make sure that prevention services especially is coordinated on a very localized level. So we're looking forward to that work, coming to the fore in service delivery. But I also know the head of health has spearheaded some intersectoral, in government people love to work in departmental silos.
Yes.
And I see now that there's this kind of transversal approach to bringing people together around issues. There's very high level talks amongst HODs around mental health, and so there's an infusion of that commitment inside these systems. And so we want to help it along, as I said before, in our sort of audit of what exactly is happening on ground level, so that we can map it out. We can understand it. We can guide citizens, children and their families to seek help where it is possible for them to get it. So I think for us, this child-centered approach to society will coalesce that urgency to come together. I will always beat this drum, and other people are welcome to use other drums to enhance society. But for us, really, a child-centered approach to doing things, understanding, working, listening to children. They only accept change when their views have been taken on board and have actually affected decisions. Because that is their participation right. To participate in all decisions affecting their life. That is their right. And so we try to create that pathway for them to talk with these high-level decision makers in government, in parliament. Some of our children even represented us at the United Nations and were commended for the type of issues that they put on the table of the United Nations Committee on the Rights of the Child.
That's amazing. I mean, I think I started this conversation saying, I was a little bit dreading the conversation just because of what we're talking about. And I'm still dreading the topic, of course. But I think the hope around what you're talking about is a good kind of space in as we're concluding the conversation, is that we have to recognize what's happening in our country. We have to understand, we have to do research, we need to understand what's happening. But we also need to document these positive outcomes that are associated and that's coming up, and kind of understand the problem, but not be stuck there. But to go, we have the situation, we don't want it, what do we do? Who do we work with? How do we bring different parties together in order to create that collective urgency? And I think that it's nice for me to hear that there's that movement that you can recognize. Because I don't think you will recognize it if it's not there.
No.
And so that's important that movement is there. But I think as we conclude, what is the take-home that you want people who are listening and watching this today, tomorrow, whenever it is that they are watching this, to even know or to prioritize around the issue of Filicide? Because there's so much I wanted to talk about that we didn't get to. And hopefully we'll get to at a later stage. What is that one thing that you want them to take home?
I think for me it's really that it has to be spoken about, and we shouldn't, keep it undercover, because it's not going away. It has happened before. It will continue to persist. So I think it's around not shying away from having these conversations, and I think people usually, when they hear these, are in shock about how can a parent, you know. So I think it's really about changing the way we think about things that happen, or the way parents, and I'll speak about parents a little bit more, because the focus right now, and Christina can speak about that, is really on parents are going, as South Africans, parents are going through a lot, considering the macro and the structural things that are happening, but also at the individual level, there's a lot that they go through. And so it's really about understanding that it's just a combination of things that are happening for an individual. And so it's not as simple as how could a parent, she or he is a bad person. And I think that is where I want to end, because it's not as simple as that.
Right. Powerful, yeah.
And yeah, I would like to see us, of course, invest much more in prevention, reduction of risk, the building of resilience, and to understand that children are key stakeholders in contributing to our vision for a better society. They are interested in the society getting well, and all of us claiming and being able to have rights. You know, so I think for me that is will always be my ending point. That the closer we come to a child-centered society, the more hopeful we can become about the future.
Yes. And in terms of research, where's your work going? Like, where do you think research should be going? I mean, there's a couple of things. We're talking about prevention, so we need to understand what are those prevention mechanisms that need to be in place. If there are mechanisms in place, do they work? How do we change the connections? You said that there's no kind of strategies to connect this department with that department.
Yes.
So where should research be going? What are those urgencies in research?
I think for me, one is to actually look at the availability of prevention and intervention strategies. So that would be something that we could really look at, and it could be, mapping those out across the country, because it looks very different in the Western Cape to what it looks like in other parts of the country. I think another part that we need to look at is really, and this is maybe not something I would take on right now, but is really theorizing around the why of the because that steps into the prevention work. And so there's not much around that. We see those research from internationally that doesn't apply to South Africa. And so I think those are the things that we need to theorize for South African families around filicide and why it's happening, which we can't really do much of right now, but we can start working towards that. And then something that is maybe where we can make a point, or we can be linked to policies, is really around categorizing child homicides as a separate category of murder, because currently it's not. And so what happens is we can't really see, it's just classified as murder. And so we can't see what's happening with child murders, and so we don't get the true picture. And so that is actually something that was shocking to me when I saw that.
You know why I'm shocked? It's because we're talking about filicide. We're talking about that, but what you're saying is legally?
Yes.
That
so it's under...
Murder is murder, and filicide is not necessarily a category of murder.
It's not. So it's just, so everything is, so child murders is within murders, and so when we get the stats, it's just that. So we can't actually see different types of child murders. So for example, child murders can be male on male teenagers in school.
Oh, I understand.
Do you understand what I'm saying? We can't see any of those in the stats even. So I think that is something from a quantitative perspective to be able to show us the true magnitude of it. The problem.
So better monitoring systems essentially to be able to document that. I mean, I think that just hearing you, and I have a whole lot of questions just around the reasons that you were talking about. Why is this happening? And I'm sure that, you will probably get a whole lot of questions more
Yeah.
just around this. So if people wanted to get hold of you or connect with either of you, how could they do that?
On my email or on my WhatsApp. I don't know if I should give it here or if it will be.
Can you come
Okay.
to your email?
My email is chikan@hsrc.ac.za.
Right.
Yeah, I think email is better, and then I can't remember my WhatsApp number.
Do not give the WhatsApp number. and for you, and also I know that your work is very specific with young people, and so who can get in contact with you in relation to some of these issues and how?
Everybody, especially children. So I will give my WhatsApp number because it is a public WhatsApp number. Hi, Tina, especially if you're a child. But you can say hi, Tina, if you're an adult too. 083 776 7067.
I have to write that down. 083
776 7067. And then the email is childrens.commissioner@wccc.gov.za. childrens.commissioner@wccc.gov.za. We have lots of other forms of talking with each other and with children. So there's the Gram and TikTok and YouTube as well. You will just search us and you'll find us there.
I'm going to have to kind of upskill my social media game here because you're talking about all these different things. Thank you so much for this. My hope is that people who are engaging on this platform will also share and talk to different people about this very important topic. But I am very sure that they've learned so much from both of you, both from the perspective of what's happening, but also from the perspective of the hope of what can happen. And I think just having this conversation is a hopeful conversation because as soon as we bring knowledge to people, they understand something a little bit better. Maybe there's a parent listening now that is able to go, okay, gosh, maybe I should seek some support in some way. So thank you so much for being part of this panel. Hopefully we can do some more discussions and we'll see how this works out. So thanks so much for joining us today. And I'm Candice Groenewald and this has been the HSRC Connect.